Hi, it's Bruce Williams again, and I'd like to continue our lecture on the select gross pathology of the GI tract of swine. As I do at the beginning of all my lectures, I want to thank all the colleagues who have provided images to me over the years, either directly or through the online collections of images such as the Pathology Image Group International or Noah's Archive. Let's start with a clinically insignificant finding that we may see in the normal pig. This is a great picture by Raquel Rech at the Texas A&M University, and this shows the wrinkling of the muscularis of the ileum of pig, and this can be a totally normal finding and unassociated with any clinical disease. Don't confuse it with this clinical disease, which goes by a number of names, including porcine proliferative enteritis, necrotizing or regional ileitis, or intestinal adenomatosis, and is caused by infection by Lawsonia intracellulare in pigs, a number of species which are susceptible to this organism. It's a classic disease in the pig, affecting the ileum and resulting in a number of different appearances, at least 3 very different looks to this disease. In this particular image, we see that the mucosa, not just the muscularis, but the mucosa, is thrown into these very rugose folds, and that is due to this bacterium's predilection to cause unbridled proliferation of the mucosa of the ileum in this species. In addition, another syndrome can be seen with Lawsonia infection called hemorrhagic bowel syndrome in pigs. And this is associated with sudden death, and look at all of the blood in the GI tract. Acute cases are most oftenly seen in late finishing pigs and young breeding stock. And you'll see acute diarrhea, which contains brown to black unclotted blood and associated pallor of the mucous membranes, weakness, and rapid death. Here's another look to Lawsonia infection, and you can see that a large portion of the mucosa is covered with a thick yellowish fibrinonecrotic membrane. This particular variant is called necrotic enteritis and results from extensive coagulative necrosis of the mucosal epithelium and often results again in rapid death. Subacute to chronic cases occur more frequently in grower stages, and this is manifested by sporadic diarrhea, wasting, and various growth rates. This particular lesion can easily be confused with salmonellosis, which we'll look at in a minute. Some pigs, in addition to this fibrinonecrotic membrane, often have the severe proliferation of the mucosa of the ileum and rarely can be clinically asymptomatic. Here's one of those that we can see both that glandular proliferation of the mucosa, which initially gave this name intestinal adenomatosis, and then overlying this area we see that yellowish fibrinonecrotic membrane. Let's move on to another very important disease of swine that affects the GI tract, and that's salmonellosis. Here we have 2 dead pigs, and I want you to notice the cyanosis of the extremities to include the legs, the ears, and the snout. The pig on the right also has diffuse cyanosis of the ventrum, or at least blood accumulation. I'm going to discount that at this point as possibly livor mortis, which would be the accumulation of blood if this animal died in sternal recumbency. But he also would have the cyanosis of ears, snout, and the legs. This is what you would see with host-adapted versions of Salmonella enterica, including cholera suis and typhi suis. These diseases manifest in the acute phase as a septicemia, and as the bacteria are killed, they liberate large amounts of systemic endotoxin, which are enough to cause systemic vascular damage and venous thrombosis as well as arterial thrombosis at the extremities. And this will result in this characteristic cyanosis that we see. You'll also see other evidence of vascular damage, including interstitial pneumonia and edema, glomerulonephritis, and button ulcers in the colon, which we will look at shortly. And here they are now. Here's a colon of a pig affected with Salmonella cholera suis, and we see these prominent raised ulcers, which is why it was given the name button ulcers. And these arise from two of the tendencies of Salmonella cholera suis or typhi suis. One, to affect the vasculature of the gut, but probably more importantly, it replicates and causes necrosis initially in lymphoid tissue. And I will bet you underneath each of these ulcers is a focus of lymphoid tissue that was initially attacked by the bacterium. Here's some absolutely gorgeous volcanic ulcers, a progression of those button ulcers, which we see in this case of Salmonella typhi suis. Eventually, necrosis in the gut is going to spread away from the lymphoid tissue and affect the entire mucosa. But this is an early sign of necrosis in the colon. There are a couple of other rule-outs for this particular lesion that we should not ignore, to include the virus that causes hog cholera or classical swine fever, porcine pestivirus, and also in neonatal pigs, Clostridium difficile will cause a necrotizing typhlocollitis with very similar volcanic ulcers in the colon. As we said before in this wonderful picture by Jose Ramos Vera, eventually the necrosis will spread to the mucosa itself. At this point, it makes, from a gross perspective, Salmonella cholera suis and typhi suis, which cause septicemia, makes it very difficult to tell that from the non-host adapted strain of Salmonella typhimurium, which also can be common in pigs, generally does not cause a septicemia, but will cause this diffuse mucosal necrosis throughout the small intestine, large intestine, and all the way to the rectum. Don't sleep on porcine pestivirus. This is hog cholera. It looks very much like the late stages of Salmonella cholera suis or the disease caused by Salmonella typhimurium. We're about to finish up the small intestine. The most important parasite from a Helminth perspective in the pig is Ascaris, a wonderful picture by Dr. Jaime Gomez Laguna. Ascaris can affect all ages of swine, but is generally most common and most severe in young growing pigs. Early on in history, the ascarid that caused ascariasis in people and pigs were thought to be the same worm, but they have obviously been divided out now. Ascaris causing disease in pigs, Ascaris lumbicoides in people. Generally, it doesn't cause too many problems unless you have a severe infection, as you see here, almost occlusion of the gut, and this animal will probably be a very poor grower. Interestingly, when you open up a gut that's full of roundworms, the odor is a very sweet, sugary odor. Here is one more important parasite of the GI tracts of pigs, and this is Macrocantharynchus horudinaceus. This parasite occurs only in swine, and usually in swine that are raised outside, because the intermediate host of this larval parasite is a beetle. So mostly the animals have to have access to the outdoors where they could get into the beetles, and we usually see this today in wild pigs, often in the southern states. Pigs with heavy infection might become unthrifty and have rough hair coats. It usually doesn't cause too much problem, but sometimes these thorny-headed worms will burrow so deep into the muscularis they'll actually go through the wall of the gut, resulting in perforation, peritonitis, and death. Let's move into the large intestine. We're looking at the spiral colon of the pig in this classic image from the AFIP archive, where we can see hemorrhage and a superficial fibrinonecrotic colitis. Historically, many instructors have called this a Turkish towel appearance. And this is swine dysentery. It takes a number of different appearances, which we will look at, but is usually a very superficial necrosis. By the damage you see grossly, you would expect something that's a full thickness mucosal lesion. Oftentimes it's very superficial. And here's another picture where we don't really get the fibrinonecrotic membrane, but we certainly have a tremendous amount of reddening, hemorrhage, and a little bit of fibrin attached to the mucosa due to the superficial nature of the necrosis. Swine dysentery is caused by a number of spirochetes. Most classically, Brachyspira hyodyssenterii. And another organism that's been identified in the last 10 years, known as Brachyspira hampsoni, which probably have identical gross images. Superficial necrosis of the colon. Occasionally you can get a full thickness lesion, but it looks a lot worse grossly than it does histologically. A third spirochete that you probably should be familiar with that causes a disease known as spirochetal colitis in pigs, guinea pigs, and primates is Brachyspira pilosecolli. In this condition, the spirochetes tend to line up in such large numbers they cover every square inch of gut. Where they can rarely look like this, the lesions tend to be a little less severe in their gross aspect. Here's another older picture of swine dysentery. Note the reddish colon and that thin veneer of diphtheritic or fibrinonecrotic membrane. And finally, here's a more severe lesion. It looks a little bit like what I've shown you with Lawsonia or Salmonellosis, but it's affecting the colon. So I think that alleviates the possibility of Lawsonia. Certainly, I would consider Salmonellosis in my differential diagnosis for this lesion. Another Hellman's parasite of mostly feral swine is Trichuris suis. And it looks very much like it does in the dog with Trichuris vulpus, with these long worms embedded in the mucosa, hemorrhage from the sites where they penetrate the mucosa, but it does not result in anemia. They're not bloodsuckers. Look at this red gut. I want you to think about the lesion that we saw in part 1, which is a red gut in a very young pig. And look how different this particular gut is. We are looking at severe venous congestion. But look at the amount of air trapped in the gut. It's almost like someone inflated it with a bicycle pump. And this is a mesenteric torsion or mesenteric volvulus. And these occur sporadically in pigs like they do in all other species. There aren't any established predisposing causes. They usually die very quickly without warning. And there have been a lot of theories, including rapid ingestion of a large amount of feed or water, or competition and piling on of pigs that are crowded too much, use of highly fermentable rations. But there is no one cause for this, but it gives a very particular classic lesion, mesenteric torsion. Inguinal hernias in male pigs are common, and in this case, it is extending into the scrotum. If you take a pig with a inguinal hernia and suspend it by the forelegs and shake down, you will see a small hernial bulge which will confirm the diagnosis. It's also seen in female pigs and usually accompanied by arrested genital development, and these female pigs are sterile. Here's an incidental finding that is seen in a number of different species. I think of it most in pigs and chickens. It is a diverticulum, the small intestine, and this is known as Meckel's diverticulum, a classic incidental finding in swine. As we get close to the end of the GI tract, we go to the rectum. And one of the classic lesions that is associated either with severe inflammatory disease of this region of the gut caused by salmonella, often Salmonella typhimurium, is rectal stricture. Rectal stricture can also be caused by traumatized rectal prolapses. The condition, at least with salmonellosis, arises from diffuse severe necrosis of this part of the gut and thrombosis of two important arteries. One is the cranial mesenteric, which it brings in blood supply from the front of the rectum, and the caudal pudendal, which supplies the blood to the caudal part of the rectum. And in the fields where these two arteries meet, the blood supply is actually not very good. Nobody wants to take responsibility for there. So if you infarct both of them, when you reestablish the blood supply, you will regenerate the mucosa on one side and on the other. But in that area where the blood supplies meet, usually you get fibrous connective tissue. And this is how these rectal strictures pop up. And here's another one. The front was well supplied and is repaired. The back was well supplied, but that area between the cranial mesenteric and the caudal pudendal is poorly supplied, and the best it can do is generate fibrous connective tissue. Rectal prolapses is often the result of pigs piling on each other as a result of cold stress or piling on each other in transport, but you can even see it from severe coughing or any type of severe enteritis, and we've talked about a number of them in these lectures. And if it's traumatized, because other pigs will be interested in this, then you may end up with rectal stenosis, as we saw in the last couple of images. And then the pig, as this heals, will be unable to defecate and will end up with megacolon. Another cause of megacolon in very young pigs is atresia ani. This is far less common in swine than inflammatory disease or previous rectal prolapse. The resultant megacolon from here may not be clinically apparent until several weeks of age, and when opened up, the pig may look like this. This is a 4-week-old pig. Let's look at one more lesion. There's a great picture by Oscar Okasada, And it's not really a lesion of the intestinal tract, but it is on the surface of the intestinal tract, so now's a good time to incorporate it. This is a condition called Mesenteric Emphysema. It is a incidental finding, probably doesn't mean anything, often seen in slaughter. The interesting part about these little bubbles on the serosa of the intestine is that they are dilated lymphatics. And they're not simply dilated lymphatics, but they are often surrounded by granulomatous inflammation, suggesting the possibility that's never been established that this may be the result of fermentative gases produced by various bacteria. But nobody's ever identified bacteria in the lesion, so it's just a nice incidental finding. Here it is on the surface of the ileum, and this is a twofer. So if you told me that this was normal ileum with the wrinkling that we see as an incidental finding and the incidental finding of mesenteric emphysema, that would be great. If you chose to say this is an animal with Lawsonia intracellulare infection, that would probably be an acceptable assessment as well. Well, that's it for the GI tract of the pig. I hope you've enjoyed this lecture, and I hope you have a great day.